All right, welcome back. You've really thrown us a curveball this time, sending in a study guide for an exam on anemia and endocrine drugs.
Wow.
That's a pretty intense combo.
It is. Yeah, it's fascinating, actually, because it touches on some core survival mechanisms,
Yeah,
how your body makes blood, manages energy, reacts to stress.
yeah.
It's a lot more interconnected than people realize.
Right, right.
Yeah,
Okay, so you're prepping for this exam, which means you need to know not just the what of these drugs,
right.
but the why.
Exactly, yeah.
We're talking about how different anemias are treated, why iron is so crucial and not just for blood,
Right.
and how meds can actually mimic hormones your body naturally produces.
Yeah, we'll definitely get into all that.
Okay.
But first, imagine this. Your bone marrow is like a bustling factory,
Okay.
churning out every single blood cell in your body.
Oh, wow.
That's hematopoiesis in action.
Wait, so every red blood cell that carries oxygen, every white blood cell fighting off infections, they all start in the bone marrow.
Yes.
That's
Yeah.
wild.
And it all starts with these incredible things called pluripotent stem cells.
Okay.
They're like the blank canvases of your blood system,
Yeah.
capable of becoming any type of blood cell your body needs.
Wow. That's incredible.
They're mind-blowing, right?
Yeah. It's like having a tiny, super efficient factory inside you.
It is.
But what happens when that factory can't keep up and your blood isn't carrying enough oxygen? That's where anemia comes in, right?
Exactly.
Yeah.
Anemia essentially means you don't have enough red blood cells or they're not doing their job properly.
Right.
And without enough oxygen, your body just can't function at its best. You're
Okay.
going to feel that lack of energy big time.
Yeah, I can imagine.
Yeah.
The study guide mentions fatigue, weakness, paleness.
Yeah.
It's like your body's saying, hey, I need more fuel here.
It really is like running on empty, but on a cellular level.
All right.
Now, one of the most common types is iron deficiency anemia.
Okay.
And it's not just about feeling tired. Think about those all-nighters you're pulling, studying for
Yeah.
this exam. You need iron for energy production, DNA synthesis, even to keep your immune system strong enough to fight off those pesky study session colds.
So it's not just about red blood cells. Iron is crucial for basically everything.
Exactly.
Now I'm starting to understand why it's such a big deal.
And the good news is there are plenty of ways to boost your iron intake.
Okay.
Red meat, poultry, seafood, beans, leafy greens. The list goes on.
Wow.
But here's a little tip for better absorption.
Okay.
Pair those iron-rich foods with a glass of orange juice.
Oh.
The vitamin C gives your body a helping hand in absorbing that iron.
So that's why my doctor always told me to take my iron supplements with orange juice.
Right.
Makes so much sense now.
It does.
But speaking of supplements,
Yeah?
they do come with some, shall we say, interesting side effects, right?
Ah, yes, the dreaded constipation.
Yeah.
And let's not forget about those dark, almost black stools that can be a bit alarming if you're not expecting them.
Oh, yeah.
But hey, at least you'll know the iron is working.
Good point. Good
Yeah.
point. But iron isn't the only nutrient your body needs for healthy blood, is it?
Nope.
The study guide also mentions vitamin B12 and folic acid.
Yes. Both B12 and folic acid are essential for red blood cell production and DNA synthesis.
Okay.
But here's where things get a little tricky. B12 needs a special helper,
Ah.
a protein called intrinsic factor to be absorbed from your gut.
Okay.
Huh.
Wait, so if you don't have enough intrinsic factor, you can't absorb B12.
That's right.
What happens then?
Well, that's when you run into a condition called pernicious anemia.
Okay.
It's an autoimmune disease where your body actually attacks the cells that make intrinsic factor.
Wow.
And that can lead to not only anemia, but also neurological problems.
Oh, gosh.
Scary stuff.
Okay, so that's iron, B12, and folic acid.
Mhm.
But what if your body just isn't making enough red blood cells, even with all the right nutrients? That's where those erythropoiesis-stimulating drugs come in, right?
You got it.
Like epoetin alpha.
These drugs are like little cheerleaders for your bone marrow,
Yeah.
giving it that extra push to produce more red blood cells.
Oh, I like that.
They work by mimicking a natural hormone called erythropoietin, which your kidneys usually make.
So it's like giving your body a little boost.
Yeah.
And I remember from the study guide that epoetin alpha is used for anemia related to kidney failure, HIV treatment, chemotherapy. It's quite versatile.
It is, but here's the catch.
Okay.
You always need to know why someone has anemia before using this drug.
Right.
Imagine treating the symptom, without addressing the cause.
Oh,
You could
no.
miss a serious underlying condition.
That makes a lot of sense.
Yeah,
It's like putting a Band-Aid on a broken bone. You
exactly.
need to get to the root of the problem.
Right.
And speaking of problems, we also need to talk about cancer. I mean, this study guide really covers it all.
Yeah, cancer is unfortunately a big part of medicine, and understanding how it works is crucial, especially when it comes to these powerful chemotherapy drugs. At its core, cancer is uncontrolled cell growth, which can happen for a lot of different reasons.
Yeah, the study guide mentions genetics, viral infections, environmental factors.
Right?
It really highlights how important lifestyle choices are.
It does.
Right. I mean, we can't control everything.
Right.
But making healthy choices definitely helps stack the deck in our favor.
You're absolutely right.
Okay.
We can't control our genetics, but we can control things like diet, exercise, and whether or not we smoke.
Right.
And early detection through screenings is also a powerful tool.
Yes.
Speaking of treatment, chemotherapy is often a cornerstone of cancer care.
So how does chemo actually work? I know it targets rapidly dividing cells.
Yeah.
But isn't that a problem considering our healthy cells also divide?
That's the double-edged sword of chemotherapy. It's like trying to weed a garden with a flamethrower.
Oh.
You're going to get the weeds, but you might scorch some of your prized flowers in the process.
Right.
That's why chemo often comes with such intense side effects.
Yeah. The study guide mentions nausea, vomiting, fatigue, hair loss. It's a lot to go through.
It is.
And then there's the whole issue of cancer cells becoming resistant to chemo drugs over time.
Exactly. It's a constant battle. And researchers are always trying to find new and better ways to target cancer cells specifically, minimizing damage to healthy cells.
Right.
That's where a lot of the exciting new research is
I
happening.
can imagine.
Yeah.
So let's talk about some specific chemo drugs.
Okay.
The study guide starts with Methotrexate.
Methotrexate is fascinating because it's used for both cancer and autoimmune diseases,
Oh.
like rheumatoid arthritis.
Oh, wow.
It basically slams the brakes on cell division, which is helpful in both cases.
So it's kind of a multitasker,
Yeah.
but since it affects so many different cells, I imagine there's a lot of monitoring involved.
Absolutely.
Okay.
We're talking about potential bone marrow suppression,
Okay.
liver toxicity, lung complications. It's a drug that requires a lot of careful monitoring and communication with your healthcare provider.
That makes sense.
Yeah.
Now on to two more chemo drugs,
Okay.
Doxorubicin and Tamoxifen.
Okay.
I've heard Doxorubicin has a pretty unique side effect.
Ah, yes.
Uh-oh.
Doxorubicin can turn your urine red.
Really?
It's certainly one way to remember it.
Well, at least you know it's working.
Yeah.
Though maybe warn your roommates before they use the bathroom.
Good point.
Now, Tamoxifen is primarily used for hormone receptor-positive breast cancer.
Right.
It works by blocking the effects of estrogen,
Okay.
essentially cutting off a fuel source for those cancer cells.
So it's more targeted than doxorubicin.
In a way, yes.
Okay.
It's designed to specifically target those breast cancer cells that rely on estrogen for growth.
Gotcha.
But as with any medication, there are potential side effects, like blood clots and even a slight increase in the risk of uterine cancer.
Oh, wow.
It's all about weighing the benefits and risks for each individual patient. It sounds like there's a lot to consider with each of these drugs.
There is.
But before we dive into the endocrine system, maybe we should take a quick breather.
Yeah, good idea.
We've covered a lot of ground already. All right, let's jump back into this endocrine system roller coaster.
Okay.
I'm still wrapping my head around how many different hormones our bodies produce
Right.
and how they all work together.
It truly is a remarkable system.
It is.
Think of it as an intricate communication network, with hormones acting as messengers,
Okay,
carrying instructions to different parts of your body.
gotcha.
And when those messages get scrambled or lost in translation,
Uh-oh.
that's when you start to see problems.
It's like having a miscommunication in a game of telephone,
Yeah,
but with your body's functions.
exactly.
Speaking of miscommunications, the study guide mentions a whole bunch of endocrine disorders.
Yeah.
We talked about anemia earlier, which is more of a blood issue, but what about things like hypothyroidism and hyperthyroidism? Those seem to be all about the thyroid gland, right?
You got it.
Okay.
The thyroid gland is like your body's metabolic control center,
Okay.
and the hormones it produces,
Mm-hmm.
thyroxine, T4,
Mm-hmm.
and triiothyronine, T3,
Right.
basically dictate how fast or slow your engine runs.
So if your thyroid is underactive, like in hypothyroidism, everything slows down.
Exactly.
The study guide mentions fatigue, weight gain, even feeling cold all the time.
It's like your metabolism is stuck in first gear.
Mm.
On the other hand, If your thyroid is overactive, like in hyperthyroidism, everything speeds up.
Okay.
You might experience weight loss, rapid heartbeat, anxiety,
Oh, wow.
and even feel hot all the time.
So it's like your metabolism is stuck in overdrive?
That's how
That sounds exhausting.
it can be.
But thankfully, there are medications to help regulate thyroid hormone levels, right?
Absolutely.
Okay.
For hypothyroidism, the go-to treatment is levothyroxine,
Okay.
a synthetic form of T4.
Right.
It's basically hormone replacement therapy, giving your body the thyroxine it needs to function properly.
And for hyperthyroidism, the study guide mentions drugs like PTU and Methimazole. Do they work by slowing down the thyroid?
Exactly.
Yeah.
They work by inhibiting the production of thyroid hormones,
Right.
helping to bring those levels back down to a normal range.
Right.
But as always, monitoring is key.
Right.
These drugs can have some potential side effects.
All right.
So regular blood tests are important to make sure everything is running smoothly.
That makes sense.
Yeah.
Now, what about other endocrine disorders? The study guide mentions Cushing's syndrome and acromegaly,
Okay.
but I'm not really familiar with those.
Cushing's syndrome is caused by prolonged exposure to high levels of the hormone cortisol,
Okay.
which is that fight-or-flight hormone that helps us deal with stress.
So if you're constantly stressed, your cortisol levels stay high,
Right.
and that can lead to Cushing's syndrome.
It's more complex than that, but chronic stress definitely plays a role.
Nope.
You can also get Cushing's from tumors that produce excess cortisol.
Right.
Or from taking high doses of corticosteroid medications like Prednisone for a long time.
Okay.
It's a fascinating condition because it highlights the delicate balance of hormones.
Right.
And how too much of a good thing can actually be harmful.
And what about acromegaly?
Okay.
I remember it has something to do with growth hormone, right?
Acromegaly is a rare condition caused by too much growth hormone,
Okay.
usually from a benign tumor in the pituitary gland.
All right.
And since growth hormone influences bone and tissue growth, people with acromegaly often experience enlargement of their hands, feet, and facial features.
So it's like their body just keeps growing?
It can be, especially because the changes happen gradually.
Okay.
And people might not realize what's going on until the symptoms become more pronounced.
Gotcha.
And unfortunately, there's no quick fix.
Right.
Treatment usually involves a combination of surgery to remove the tumor,
Okay.
radiation therapy, and medications to block the effects of growth hormone.
Wow, that's a lot to handle.
It is.
Okay, moving on. The study guide mentions another condition called polycystic ovary syndrome, or PCOS.
Yes.
Now, that one I've actually heard of,
Okay.
but I'm still a little fuzzy on what exactly it is.
PCOS is a hormonal disorder that affects women of reproductive age.
Okay.
And it's actually quite common.
Oh, okay.
It's characterized by irregular periods,
Right.
excess androgen hormones. Those are typically thought of as male hormones.
Okay.
And cysts on the ovaries.
So it's like a hormonal imbalance specifically affecting the ovaries.
Exactly.
Okay.
And it can cause a wide range of symptoms from irregular periods and acne to excess hair growth and weight gain.
Oh, gosh.
And because it affects the ovaries, it can also make it harder to get pregnant.
This is probably a dumb question.
No.
But why is it called polycystic ovary syndrome if the cysts aren't actually the main problem?
Right.
It seems like the hormonal imbalance is the bigger issue.
That's a great question. And it highlights how medical terminology can sometimes be a bit misleading.
Right.
The name focuses on the cysts because they're a visible sign of the condition that can be seen on ultrasound.
Okay.
But you're right, the underlying hormonal imbalance is the real driver of the problem.
That makes a lot more sense.
Yeah.
So how do you actually treat PCOS? Is it just about managing the symptoms?
There's no one-size-fits-all approach to treating PCOS, but the goal is to address the underlying hormonal imbalance and manage the symptoms.
Okay.
Lifestyle changes like weight loss and regular exercise can make a big difference.
Okay.
And medications can help regulate menstrual cycles,
All right.
reduce androgen levels, and improve insulin sensitivity.
Insulin sensitivity, that's more of a diabetes thing, right?
It is, and that's another interesting aspect of PCOS.
Okay.
Women with PCOS are at increased risk of developing insulin resistance,
Oh.
which can lead to type 2 diabetes.
Okay.
So managing insulin sensitivity is a crucial part of preventing long-term complications.
Wow, it seems like PCOS is way more complex than I realized.
It can be, yeah.
Okay, so we've talked about thyroid disorders, Cushing's syndrome, acromegaly, and PCOS. What other endocrine conditions are there?
Well, there are many more. But let's shift gears a bit and talk about some important concepts related to diabetes.
Okay.
We touched on it briefly when discussing PCOS.
Right.
But it deserves its own spotlight.
Okay, so diabetes is all about blood sugar control.
Right.
Exactly.
And there are two main types, type 1 and type 2.
Type 1 diabetes is an autoimmune disease where your body attacks and destroys the cells in your pancreas that produce insulin.
Right.
Without insulin, your body can't use glucose for energy.
Oh, okay.
And it builds up in your blood, leading to all sorts of problems.
And type 2 diabetes is different because...
In type 2 diabetes, your body either doesn't produce enough insulin,
Right.
or your cells become resistant to its effects.
Okay.
So even though you're making insulin, it's not being used efficiently.
Right.
And that also leads to high blood sugar. So both types involve problems with insulin, but for different reasons.
That's right.
And that's where those different types of insulin medications come in, right?
Exactly.
Like rapid-acting and long-acting insulin.
People with type 1 diabetes always need insulin therapy.
Okay.
Because their bodies don't make any insulin at all.
Right.
And some people with type 2 diabetes may also need insulin.
Okay.
Depending on how well they can control their blood sugar with other medications and lifestyle changes.
That makes sense.
Yeah.
But managing diabetes seems like a lot more than just taking insulin.
It is.
What about things like diet and exercise?
You're absolutely right.
Okay.
Managing diabetes is a holistic endeavor,
Mm-hmm.
and lifestyle plays a huge role.
Okay.
Eating a healthy diet, getting regular exercise, and maintaining a healthy weight
Mm-hmm.
can all help improve insulin sensitivity
Right.
and keep blood sugar levels in check.
And I imagine regular monitoring is also crucial, right?
Absolutely.
Okay.
Regular monitoring is key to understanding how your body's responding to treatment,
Right.
whether it's insulin therapy, other medications, or lifestyle changes.
It sounds like there's a lot to learn about diabetes management.
There is.
And speaking of learning, this study guide is really packing in the information.
Yeah, it is.
Maybe we should take a quick pause before diving into the next section. All right, we're back
Back again.
for the final stretch of this deep dive into anemia, the endocrine system,
Yes, okay.
and all the medications that can really make a difference in these conditions.
Right.
You know, going through this study guide with you has really highlighted just how complex and interconnected our bodies are.
It really is. It's truly humbling, isn't it?
It is. It's fascinating.
Yeah.
We've talked about blood cell production, hormones, cancer, diabetes, and it all comes back to this intricate balance within our bodies.
It does, yeah.
It's like a giant puzzle where each piece plays a crucial role.
Right.
Speaking of crucial roles, the study guide mentions something called palliative care.
Yeah.
Is that just for end-of-life situations?
That's a common misconception.
Oh,
Palliative care is all about improving quality of life for people facing serious illnesses, no matter what stage they're at.
okay.
It's about addressing not just the physical symptoms, but also the emotional, social, and spiritual aspects of living with a serious illness.
So it's a more holistic approach, focusing on the whole person.
Exactly.
Boy.
And here's the important part.
Okay.
It can be offered alongside curative treatments.
Oh, okay.
It's not an either-or situation.
Right, right.
In fact, studies have shown that integrating palliative care early on can actually improve treatment outcomes.
That makes a lot of sense.
Yeah.
It's about providing support and comfort throughout the entire journey.
It is.
Okay, shifting gears back to medications.
All right.
The study guide mentions something called vesicants.
Okay. What are those?
Vesicants are drugs that can cause serious tissue damage if they leak out of the vein during 5 administration.
Oh, wow.
Imagine a chemical burn, but inside your body.
Oh, no.
Not a pleasant thought.
Definitely not.
And the study guide mentions that many chemotherapy drugs fall into this category. That sounds pretty scary.
It can be, which is why it's so important to have these drugs administered by trained healthcare professionals
Right.
who know how to handle them safely.
Of course.
And if you're ever getting IV chemo, always speak up if you feel any burning, stinging, or pain at the injection site.
Okay.
It's better to be safe than sorry.
Absolutely. Absolutely.
Yeah.
Speaking of chemo, we talked earlier about bone marrow suppression being a potential side effect.
Right.
The study guide also mentions something called neutropenic precautions. Is that related?
You're quick on the uptake.
Well, you're a good teacher.
Neutropenic precautions are all about protecting people with weakened immune systems,
Okay.
specifically those with low neutrophil counts.
Okay.
Neutrophils are a type of white blood cell that plays a crucial role in fighting off infections.
So if your neutrophil count is low because of chemo,
Yeah.
you're more vulnerable to infections.
It-
What kind of precautions are we talking about?
It's all about minimizing exposure to germs.
Okay.
Think frequent hand washing.
Right.
Avoiding contact with sick people.
Nope.
Maybe even wearing a mask in crowded places.
Right.
Sometimes visitors might even be restricted to protect the patient.
Wow.
It could be pretty intense.
That's a lot to consider.
It is.
Okay, let's move back to the endocrine system for a bit.
Okay.
We talked about cortisol earlier, but what about aldosterone?
Okay.
It's another hormone produced by the adrenal glands, right?
Right. Well, cortisol is known as the stress hormone. Aldosterone is all about regulating your blood pressure and electrolyte balance.
Okay.
It works by helping your kidneys hold on to sodium and get rid of potassium, which is crucial for maintaining fluid balance and a healthy blood pressure.
So if you don't have enough aldosterone, your blood pressure could drop.
Exactly.
Okay.
And you could also experience fatigue and electrolyte imbalances.
Right.
That's why people with adrenal insufficiency, where the adrenal glands aren't producing enough hormones, often need medication like fludrocortisone, which is a synthetic form of aldosterone.
It's amazing how one little hormone can have such a big impact on the body.
It is.
Speaking of big impact, what about adrenaline?
Okay.
Isn't that also produced by the adrenal glands?
You got it.
All right.
Adrenaline, also known as epinephrine, is our fight or flight hormone.
Right.
It's what kicks in when you face a sudden threat,
Okay.
like a near-miss car accident.
Right.
Or when you're about to give a big presentation.
Yeah.
Yep.
So it's the hormone that gives us that surge of energy and makes our hearts race.
Exactly.
Okay.
It's designed to help us survive those critical moments
Right.
by making us more alert, boosting our strength and speed, and sharpening our focus.
It's like our body's own superpower.
It is.
But too much adrenaline can't be good, right?
Right.
Especially if we're constantly stressed out.
You're absolutely right.
Okay.
While adrenaline is essential for survival in short bursts, chronic stress can lead to prolonged elevation of adrenaline levels. And that can take a toll on your health.
Right.
We're talking about increased risk of high blood pressure,
Right.
heart disease, anxiety, depression,
Wow.
even digestive problems.
So finding healthy ways to manage stress is crucial, not just for our mental well-being,
Absolutely.
but for our physical health as well.
It is.
Okay.
Things like exercise, meditation, spending time in nature, connecting with loved ones.
Right.
They all play a role in keeping those stress hormones in check.
Well, we've covered a lot of ground in this deep dive, from anemia to the endocrine system to a whole range of medications.
We have.
It's been quite a journey.
It has.
As we wrap things up, any final thoughts for our listener who's gearing up for that big exam?
I think the biggest takeaway is this.
Mm-hmm.
You're not just memorizing facts for an exam.
Right.
You're gaining knowledge that can empower you to understand your own health and advocate for yourself.
That's a good point.
Remember, there's always more to learn.
Mm-hmm.
And being curious and engaged is the best way to navigate the complex world of medicine.
Couldn't have said it better myself.
Thanks for having me.
Thanks for joining us on this deep dive, and best of luck on that exam.
Good luck.
We're rooting for you.